there's been growing concern about the possible role of shift work, particularly night work, in long-term ill health. And part of the concern really stems from the fact that shift work and night work has been increasingly prevalent over the last 50 years. Now, there's lots of definitions of shift work that presents a problem for epidemiologists like myself when you're designing questions. But in general, we can say that shift work is a practice designed to make the most of the 24-hour clock economically. And anybody here who's worked in shift work will be aware that actually there's lots of different shift work systems. There's different types of shift work. There's night work, there's fixed night work, there's rotating night work, there's flexible night work. So lots of different shift systems. But we're particularly interested in the effect of working through the night. Now, in the Million Women study, in accordance with what we can see more generally in the UK population, night work is surprisingly common. So about 13% of women in the Million Women study have told us that they've ever worked at night. And even more interestingly, as we'll come on to see, a reasonable proportion of them have worked long-term night work. So we see of our whole cohort, about 2% of women have worked at night for 20 years or more. And that's about 14% of the night workers. So why are we talking about it today? Well, as you can see from the title, there's been a lot of concern about the possibility of an increased risk of breast cancer in night workers, particularly long-term night workers. This concern's not particularly new. It started off in the 1970s, where people working on rodents observed that rodents under electric light at night had increasing rates of mammary tumours, and they tracked it back to a hormone called melatonin. All of us have a big surge of this hormone melatonin overnight. And if we're exposed to light at night from electric lights, that melatonin surge is suppressed, and that has a whole host of physiological consequences, not least affecting our hormones. So over the 70s, the animal evidence started to accrue, and then in the 80s, people started to say, well, could this have an effect in women? And the hypothesis was put forward that increasing rates of breast cancer, particularly in industrialised nations, might be due to electric light use and to night work. So what followed was a host of small epidemiological studies. Such was a concern and the kind of growing body of evidence of different types that in 2007, the World Health Organization's International Agency for Research on Cancer put together a review group, and they looked at all of the evidence. And their conclusion was that shift work involving circadian disruption, this disruption of your natural hormone cycles over the day, particularly melatonin at night. So shift work involving circadian disruption was probably carcinogenic. Now, their evidence and their conclusions were twofold. One, that they said that there was sufficient evidence in animals. So this is this body of animal evidence I told you about. But secondarily, they said that there was limited evidence in humans. Now, at the time, they had 8 studies in humans, but only really 2 with really robust results from prospective studies. So these 2 prospective studies that caused a lot of concern, I'm just briefly showing you the results here. 2 studies of nurses in the USA, and both of them showed that this group of long-term night workers had an elevated risk of breast cancer. So this line here, as you've been told, is 1, so no difference between night workers and non-night workers, and anything to the right is an increased risk in the night working group. So this group of women working 20 or more years at night in these 2 studies had an increased risk, one of about 40% in one study and about 80% in the other study. Now, one thing to briefly notice is that the number of women who'd worked at night for 20 years or more who had developed breast cancer was quite small. So there's not a lot of evidence here, but there is some evidence that caused concern, hence leading to this probable carcinogen label. Now, this had a whole host of consequences. It received a lot of media, and obviously people started to be concerned, both at the personal level, but also in terms of bodies that were drawing up guidelines for night work, and even in terms of thinking about industrial compensation. So one of the consequences was that in Denmark, this IARC classification of carcinogens is linked to your right to apply for industrial compensation. So in Denmark, since when breast cancer became recognised as an industrial injury because of night work, women were able to start applying to have breast cancer compensated for, and certain women with certain characteristics have indeed since then been compensated. It's also tied into calculations about what the occupational burden of cancer is in countries. So, for example, there's an estimate from Great Britain that once shift work became a 2A carcinogen, a probable carcinogen, one estimate said that maybe 50% of the occupational burden of cancer in British women might be due to the increase in breast cancer risk in night shift workers. So a host of consequences, and one of the consequences that affects us, and is the reason why I'm talking to you today, is that there was a call for more research, and particularly a call for more research in large-scale prospective studies, such as the nurses studies I showed you up there, and such as the Million Women study that we're talking about today. So the UK government, their Health and Safety Executive, put out a call for more research. We applied and we got funding, and so we put questions in our 12-year resurvey. So this is the project. It had two main aims. Firstly, to look at night shift work in relation to cancer, but also other diseases such as heart disease, where there'd also been concern about long-term risks. And secondly, to understand a little bit more about the risk profile of the night shift workers. And thirdly, we were also interested in exploring some of these mechanisms. Was it that night shift workers had a different host of characteristics? They were maybe had higher levels of the known risk factors for these diseases, and that was what was causing the apparent elevated risk in these people? Or was it something to do with circadian disruption and this hormone melatonin? Or maybe it's to do with sleep deficit. So a variety of possible mechanisms. So here are some of the results. So here you can see some of the known cancer risk factors that Jill talked about. We've got obesity here, HRT use here, nulliparity here, not having had any children. So known risk factors for breast cancer. And here you can see the never night workers, women who've never told us they've never done night work. And here you can see women who've ever done night work. And you can see that for these cancer risk factors, actually women who've ever done night work are worse off. So they're more likely to be in have a low socioeconomic status, they're more likely to be obese, they're much more likely to smoke, they're more likely to have used HRT. But what's really interesting to us is the characteristics of our long-term night workers, because that's really where there's been particular concern about an increased risk for breast cancer. So what do they look like? So you can see these here in this third column. These are women who've told us they've worked at night for at least 20 years. And they also have a sort of poorer risk profile in terms of known risk factors for breast cancer, but it's particularly apparent in this group for obesity and here for nulliparity. So we see that women who've worked for 20 years at night are even worse off, if you like. So to sum up from these data, we can see quite clearly that night shift workers do have different characteristics, and these characteristics would, by themselves, put them at increased risk of breast cancer and heart disease. So part of what we've been doing over the last 3 years, or longer now, is to put together evidence in the Million Women study following the 12-year resurvey, but also to draw new data from UK Biobank and also from Epic Oxford. And thirdly, we've been surveying the literature because there's been quite a lot published since 2007 when IARC did the review and came up with this probable carcinogen classification. So here I'm just showing you at the top, this is the Nurses' Health Study, some results from them that were available in 2007. And now 4 of the studies that have been published since then, the prospective studies, have also given us data on 20 years or longer of night work. And you can see from these new studies that the results are mixed, but actually the bulk of the data sitting on no association, really in the middle here. So as I say, we've been following up our Million Women study, women who followed to the 12-year resurvey, more than 500,000 of them, and also applied to use data from UK Biobank and following up those women and Epic Oxford. And we now have results for 3 new studies down here. So all of the available data, apart from our new studies, is about 600,000 women, and we're now adding data on another 800,000 women. Now, I can't show you the results today, but in the next 2 or 3 weeks, we think that we've got the paper accepted for publication. So keep your eyes open for the results that will be coming out in the next 2 or 3 weeks. But they really do make a substantial contribution to the literature, and also this new report puts together the findings from the Million Women study and the other studies in context with what's already published. So just to conclude, I've shown you an example of where the Million Women Study has responded to some issues, particularly in women's health, through putting questions into a re-survey and then following women using electronic data linkage. And the data that's going to come out will really help to inform the discussion around guidelines for shift work. But we've learnt, and it's quite clear, that these analyses have to be conducted really carefully. That shift workers have a variety of different characteristics, and we need to design our prospective analyses to take these into account. And as I say, the results from this study are going to be out in the next few weeks in the Journal of the National Cancer Institute. Thank you.